Malawi has started testing the use of drones to try and cut down on the time it takes to test for HIV infants living in rural areas. Screening of HIV in babies requires special lab tests. The research, which is being run by the UN Children's Agency, also known as UNICEF, is using simulated samples for now. The first successful test flight recently completed on a 10-kilometer route traveling from a community health center to the Kamuzu Central Hospital laboratory in the capital city of Lilongwe. Unmanned aerial vehicles have been used in the past for surveillance and assessments of disasters. But this is the first known use of the technology on the continent for improvement of HIV services.
There are many delays in the continuum of getting HIV-positive children on treatment. They need to come in early for testing, ideally before 2 months, between 6 and 8 weeks. Their tests, the dried blood spots, need to get from the health facilities to one of the 8 laboratories nationwide.
Agnes, a mother who tested positive for HIV, is on her way to the community health center to get her baby tested. Agnes says she hopes the test results will run out negative for HIV.
It's a very painful experience for me because as it is, I don't know whether my child got the disease from me or if he's okay.
Malawi has a national HIV prevalence rate of 10%, still one of the highest in the world. An estimated 1 million Malawans were living with HIV in 2013, and 48,000 died from HIV-related illnesses in the very same year. Currently, it can take almost 2 months to get samples from a healthcare facility to an equipped lab and for the results to be returned.
The results, once they're available, then need to be brought back to the health facility and communicated to the mother. And while many efforts have been made to shorten each leg of that continuum, we need to do better. Mothers are still waiting up to 2 months for those test results, and that can be a very long period in an HIV-positive infant's life.
In 2014, about 40,000 children in Malawi were born to HIV-positive mothers. This was according to UNICEF. Every year, around 10,000 children die from the virus.